I'm the director of the Association of European Cancer Leagues. We're an alliance of cancer societies from all over Europe. And one of the main issues that our patient support working group is dealing with are social challenges for patients. So what we're talking about here are employment issues. How do cancer patients deal with trying to return to work? That's just one of the issues. And if you're looking at access to insurance, for example, once you're diagnosed with cancer and you're a survivor, in Europe, it's really, really crazy and unfair because it's really difficult then to try to get insurance because health insurance or even travel insurance is a big issue. How do you get a loan from a bank? Because a lot of times when patients, once they've been diagnosed with cancer and the insurance company knows this, it's impossible to get a bank loan. So these are some of the issues that we're trying to deal with at the European level. We work with the MEPs Against Cancer. These are the members of the European Parliament. We try to raise awareness of these issues because these are psychosocial issues that, we know that cancer patients have to deal with issues such as access to treatment, access to care. But when you talk about social challenges, these are challenges that are not so obvious. So I would welcome your advice, your experience. What are your views on this? How can we at the European Cancer Leagues work on these social challenges as issues, and how do we get the policymakers raise their awareness in terms of trying to get something done in this area?
Let me tell you the experience we did in Italy, because I think Italy was the first country that got a law approved just for cancer patients. This law allows a cancer patient to choose to go from full-time to part-time job. The second thing is that later on in 2006, just for cancer patients' caregiver, we got another law giving to caregiver the priorities to get benefit of going from full-time to part-time. We have been trying to monitor this law, and we have been trying to work with big industries like Eni. Finally, they accepted after we were discussing, because they said, why this for cancer and not for cardiology and so on? Finally, we convinced them, and we, through internet, tried to let people knowing about this. But afterwards, we did, with the Chinese, is the most important social center study, a survey with 1,300 patients through our organization. And it came out that only 6 or 7% of cancer patients ask for the part-time. So we know now, I think, and this study is the first one in Europe, perhaps that we are going to publish this, how much are the social money problems for, it's a tremendous amount of money, also for Italian people that get all money for curing themselves. But the reason is that, first of all, cancer patients don't want to tell that they are sick of cancer, because still they feel that they can have problems to go back. Secondly is that industries don't work to open up their personal office to interact with them and facilitate to talk with them. So I think that, first of all, we should now work, and our experience, I think, is very important. First of all, work to see that one can be cured by the cancer, because still in the issues and so on, people feel that once get the cancer, is completely died. And I was able to show yesterday that the Italian registry for the first time did a study, and they're publishing it on Annals of Oncology, showing that they can exactly tell how many, which is a percentage of cured people. And so then we have to work out telling that people can be cured by the cancer. And the second thing, we should work, trying to get some kind of complete inversion to show that it's not something that helps cancer patients to keep their work, but that keeping these people that are still active after the cancer, that can be their job, because otherwise we won't go any place.
A personal experience, for example, a colleague of mine was diagnosed with cancer, and she could not tell her employer. Somebody who works with me, but for another organization, and she didn't want to tell her employer. And I think that is so sad, because then she's working in the area of cancer and she cannot tell her employer that she has cancer. And I find that that's just completely devastating, that you cannot share this information with somebody who's already working in the cancer field, because she was afraid that she was going to be replaced, which is a very, and that is a very realistic fear that she has. And so we were trying to, provide support to her, but, under the table. But for me, it's a real shame that you're working for a cancer control organization and you cannot tell your employer that you have cancer.
I'm combining the role of being a cancer patient, a patient advocate, and an employer. So I know both sides. I would be very happy to keep everyone on my staff who has developed cancer and even hire ex-cancer patients. But this is a risk for the society and should not be only a risk for the employer, as it is often now. I'm not Microsoft. I have a small software firm employing 15 people. So if 1 or 2 gets out, this will increase my cost. So I will be very happy to keep my staff if they get cancer, even to hire people. But I want to be compensated for that by the society.
The example that we got from Italy is really interesting, because he shows what has to be done, which is something in the member states. Because on this we are here with European patient organizations. And unfortunately, in the field we are here talking about, which is health, which is social affairs, member states are the ones who play. Even at health system, if we talk reimbursements, it's your member state. And to get you back to work, to arrange for your insurances, it's your member states. Unfortunately, Europe can think of directives, but member states are very resistant in allowing Europe to tell them what to do in their country. So we will have to act in our own countries. We will have to get new laws, because what Italy did was they got a law. And without a law, you cannot impose anything on your society. So that is the way we will have to go. And it will not be easy, because there is, again, it will cost money. Although, if you can keep a patient working years, he will be an asset to society. He will not be a cost. And they should learn to understand that. So it's in your own country that you will have to act on these aspects.
Because there's a link here about what's happening with the treatment and with aging and so on. We know that many of the cancers are linked to aging. The older you get, the more the risk from cancer. We know these things. And prostate cancer would be a classic example of that kind of cancer. But at the same time, we're lifting the retirement age all across Europe. In Poland, it's gone up by 5 years. So if we're expecting people to carry on working, they're going to be working with cancers very often. And here's where the society side comes in. I was at a meeting in Poland on healthy aging, and speaker after speaker said this: the problem is that there are too many old people. Now, I know what they meant by that, but when it was my turn to speak, I said to them, try saying this. Instead of the problem is there's too many old people, try saying the problem is there's too many black people. Try saying that. See how that sounds. Or the problem is there's too many Jewish people. Try saying that, and see how that sounds. How can you get away with saying that the problem is that there are too many old people? You would never get away with saying that about any other part of society. And yet now it's being said routinely. We know what they mean when they say this. But what it boils down to is what this gentleman has said. Society is going to have to invest in old people, and that means investing in people who have got cancer. Not least things like prostate cancer, for instance, where the men are living longer and longer with the cancer. And I think we need to send a clear message out. This is not just about cancer. This is actually about healthy aging and the way that we address the people in our society. And I agree with you 100%, sir. This is a job for society. It is not just for the employers. It's not just for the doctors. And in a sense, it's not just for us as the patient advocates. This is a job for society to look at the way we're treating people.
I do agree that with the aging society, it's the ethics of the society's duty and legislations to take care of such an issue. Patient advocacy or no advocacy, it's a reality. The median age of the world has grown older. The baby boomers have come to bloom right now. So if I really look at that particular angle is, we are going to have an issue, and that issue is going to be not just cancer, it's going to be all chronic diseases. It's going to be having a basically on the non-communicable diseases in higher numbers. So we need to have a formulation, just not from advocacy, but from society, from the legislation, how to handle this entire group of chronic diseases or non-communicable diseases and integrate them, just not cancer.
Patient should be treated as an individual from the start of diagnosis, and his pathway should be monitored all the way through. And through his needs assessment, there must be some links to say that this patient's profile is going to be prone for certain things. So when the person talks to his specialist nurse, he should be signposted to other organisations. We've got people there that could help them. So my idea is to actually be signposted and to stop that person worrying, and eventually it ended up psychologically problems and things like that. So you look at the patient's profile. Are they on their own? Have they got family support? And if that happens, then you can signpost them. You don't, I think the patient should be taken on that journey from start to finish and ongoing. And then when he's discharged to his local general practitioner, that should be another avenue of information. Thank you.
We think that we should have more importance in the local media, but not health media. The normal journal and the media, then everybody is listening, reading and watching, because the health media is who is looking or reading the health media. We are doing it. But normal people, they are not reading or watching the health media, unfortunately. So we have to go in the normal newspapers, in the normal media, paparazzi media if it's needed, to have more awareness. This is what we think.
My call for action would be also to ESMO for the next years to make more engagement or produce more engagement and more activities that we also are able to train and educate doctors how valuable this cooperation and this collaboration with patient organizations is. I think this is also part of the education, what this kind of conference could contribute in making more about this partnership. Because at the end of the day, we are sitting all in the same boat. We would like to change issues, and we also know patients could be doctors tomorrow. People from the pharmaceutical industry could be patients tomorrow. So I think it's a very, very important point also to generate more action in the direction of ESMO to educate the attendees of this conference about this valuable relationship.